Hello, I'm Jeff Cummings, Director of the Cleveland Clinic Ruvo Center for Brain Health. At the Center for Brain Health, we take care of patients with Alzheimer's disease, Parkinson's disease, and multiple sclerosis. We conduct research and perform clinical trials to try to find new treatments for patients with these brain diseases. A critical aspect of our care is to work with caregivers. This series of videos introduces you to aspects of caregiving, including how to take care of yourself.
Dementia is a word that is often misunderstood and misused. It's the general term for cognitive decline that is serious enough to interfere with daily life. The most common cause of dementia is Alzheimer's disease, which affects 5.5 million people in the U.S.
Dementia is not a specific disease, but covers a variety of symptoms, like impaired memory, communication, and thinking. The chances of dementia increase with age, but it is not a normal part of aging. Most often, dementia develops slowly, and it's preceded by symptoms of cognitive decline that aren't serious enough to get in the way of daily activity. This stage is called mild cognitive impairment.
Increasing age is the most powerful risk factor for getting dementia, and the risk doubles every 5 years after age 65. Having a parent or sibling with the disease also increases your risk. Of course, neither living to an advanced age nor having a close relative with dementia means that you'll definitely get it. Other factors that can increase your risk are a sedentary lifestyle, obesity, smoking, diabetes, high blood pressure, and alcohol abuse. There are also behaviors associated with a lower risk of dementia, including frequent moderate physical exercise, healthy social interactions, and regular intellectual stimulation.
We have all had the experiences of forgetting why we entered a room, difficulty coming up with the right word, or misplacing an object. However, just forgetting something doesn't mean you have dementia. The cognitive changes that cause dementia are prominent and persistent, and memory is not the only brain function that can be affected. Dementia can affect communication, navigation, and behavior too. People with dementia lose their ability to carry on normal activities and relationships. They also find it more challenging to solve problems and maintain emotional control. It's not uncommon for patients to experience personality changes and behavioral problems such as agitation, delusions, and hallucinations. This can be the toughest part for families, watching an active, loving parent or spouse become angry or aggressive or completely apathetic.
Doctors diagnose dementia only if 2 or more brain functions, such as memory and language skills, are significantly impaired, without a loss of consciousness. There are many causes of dementia symptoms, including Alzheimer's disease, vascular dementia resulting from brain death caused by stroke, injury such as head trauma, medications, nutritional or vitamin deficiencies, infections, brain tumors, depression, thyroid abnormalities. The dementia caused by certain conditions such as thyroid problems or medications can sometimes be reversed.
We are making some progress in diagnosing and treating dementia. We can detect signs of dementia more accurately and earlier than ever before. We're better at determining the cause of someone's dementia. There are medicines that can help in Alzheimer's disease and some other progressive dementias. These medications can't stop the spread of disease or reverse existing brain damage, but they can slow the progression of the symptoms, improve the patient's quality of life, and just as important, ease the burden on caregivers. As with most medical conditions, earlier treatment leads to better outcomes.
In the early stages of dementia, patients may benefit from increasing their intellectual, social, and physical activities. The use of memory aids, such as computerized recall devices or note-taking, can help someone with cognitive impairment maintain independence longer.
There are a lot of myths out there about diagnosing dementia. Someone who feels fine may still have dementia because most people with dementia are not aware that they have it. Brief memory screens, whether in person or by computer, brain scans, or blood tests, are potentially useful tools, but can't by themselves tell you whether you have dementia. Proper evaluation and diagnosis can only be performed by a professional familiar with these diseases, often a neurologist or psychiatrist.
If you are concerned about dementia symptoms in yourself or a loved one, talk to a doctor about being evaluated for the cause of these symptoms.